Hello and welcome. This is Health and Wellbeing, and I am Lois Sambo. Yesterday, the 8th of March 2023, was the International Women's Day. And still in the spirit of celebrating women, today on the program, we will be discussing women and their health and what can be done to improve their health. This is Health and Wellbeing on Astro Television. We're on DSTV channel 392, on StarTimes TV channel 127, and on Free TV on channel 507. We're also on the UHF band on channel 38. Every day, women face challenges which puts them at risk of deteriorating health. And with Nigeria accounting for more than 34% of global maternal deaths, it is important that women's health is prioritized. Today on the program, I'm being joined by Mr. Martins Eke, who is the program manager at the Center for Social Justice, and he's also a public health specialist. You're welcome to the program, Mr. Martins.
Nice being on the show, Lois.
And it's nice having you once again
Yeah.
on the program.
That's true.
So we're celebrating women.
Yeah.
And even though we're not going with the broad theme, which is digital, getting women to be included, more inclusion of women in tech, we're looking at something more different, health, women's health. Just like I said earlier, Nigeria's maternal death rate is high, over 36% globally. And that's something that has been a cause for concern for activists and people that are advocating for maternal health. Today on the program, I'd like us to look at it this way. Why is it important that the health of women is prioritized?
I think that women are special. Let me start from there.
Yes, we are.
Women are very special. Women have that rare gift of bringing forth children into this world. So we have to do everything possible to ensure that the species or the group or the gender that does this special role of bringing forth children into the world is preserved. And then especially if you look at the high maternal mortality ratio, ours is a very crazy figure in Nigeria, very poor, I must admit. So it means that we are losing a lot of our women to childbearing process. Therefore, we have to do everything possible to see that priority is given to women's health so that we no longer have to lose our women while they are trying to do us that favor of bringing forth children into this world. So I think that we should all celebrate women and do the best for them. The president's wife is a woman. The president's mother is a woman. Of course, the president also has daughters, and all these things also applies to me. So I think that women are special and they should just be celebrated.
Thank you for celebrating us. Okay, so what are some recommendations? Because everybody has a right to health, but because we're looking at women, I'd like us to look at the rights to health that women have. What are some recommendations that you would give that would help to strengthen the rights to health for women, most especially because, just like we said, our maternal mortality ratio is very high, which means that quite a number of women do not have access to health services that they need. So what recommendations can be given to help strengthen, the health sector and give women the right, access to health services that they need?
I think that the maternal mortality ratio being high that you've noted did not happen by chance. Generally, as a general rule, nothing happens by chance. Mm-hmm. If women are not receiving the best possible healthcare services they deserve, it means that something has gone wrong somewhere. So I wouldn't, advocate for the usual, maybe give women maybe 1,000 naira or 10,000 naira for their health or just any unsustainable practice. No, I would like to see how we can institutionalize any intervention meant to strengthen the healthcare of women. Why do I say that? Firstly, we can look at the laws governing the health sector. What are the laws governing the health sector? For instance, we have the National Health Act and others. How can we amend these laws to ensure that the interest of women is provided for in the law? Because that will be the framework upon which every other intervention is built. Apart from the laws, We also have policies, several policies governing the healthcare system in Nigeria. How can we strengthen these policies, or rather, adjust these policies such that they will provide priority for the health of women, or they will prioritize issues that are of interest to women's health? Apart from the policies, of course, there are a lot of plans in the health sector aimed at bringing life to the activities and programs of government. How can we adjust these plans, to tweak the plans to prioritize issues around women's health? And then the budget, right? How can we provide more resources for women in the budget? I'm saying this because the laws determine what is in the policies. The policies determine what is in the plans. And what is in the plan determines what goes into the budget. So if you are able to get it right across these stages, you would have laid that foundation upon which the interests of women will be prioritized. Now, imagine we amend the National Health Act to prioritize women's issues, amend the National Health Policy of 2016 to prioritize women's issues, the National Strategic Health Development Plan, and of course, the budget for health. By the time you do all this, you will discover that you have institutionalized the interest of women, and it's no longer something that comes and goes with one government or the other. It has come to stay.
Okay, so we have the Basic Healthcare Provision Fund.
Yeah.
From the name, I think you should give an inkling of what it is, Basic Healthcare Provision Fund.
Yeah.
But how can this be used to strengthen the right to health for women?
Okay, so the National Health Act of 2014 has a provision that 1% of the Consolidated Revenue Fund will be channeled into the Basic Healthcare Provision Fund. By that, we mean 1% of all the money that Nigeria gets, that is before the sharing starts taking place. So if it is crude oil money, everything that comes into the country through crude oil, if it is tax and all of that, whatever we get, 1% of it should be channeled to the Basic Healthcare Provision Fund. Now, currently, this fund operates such that a part of it is given to the National Primary Healthcare Development Agency. The second gateway is to the National Health Insurance Scheme. The third is emergency management and treatment. And recently, NCDC has been added with a small percentage of that fund going into it. But if you look at the gateway for National Primary Healthcare Development Agency, it's a sizable amount, a huge percentage, almost half of the percentage. Now, if you look at the primary healthcare system, if you look at the primary healthcare centers we have across Nigeria, it is mainly women that go there to receive services.
Most of the time.
Yes, most of the times. So that gateway is a huge amount of money, which, if well utilized, will translate to improved health outcome for women. Because you are sure that as 1% of the Consolidated Revenue Fund goes into this Basic Healthcare Provision Fund, and almost half of the Basic Healthcare Provision Fund goes to the National Primary Healthcare Development Agency, which provides primary healthcare services, of which women are the major beneficiaries, then you see an improved outcome in the health of women. So what can be done? There's a committee, a ministerial steering committee that monitors the implementation of this fund. So maybe they need to bring in more transparency and accountability into how the fund is currently being utilized. If by the time you have more transparency and accountability, more money will go into the primary health centers, because as it stands now, there are areas where, well, there's transparency, but then there are still areas where the operations of the fund is, covered in secrecy, and that gives room for some form of maybe corruption or loss of resources through the fund. So we really need to pay a lot of attention to the National Primary Healthcare Development Agency gateway of the Basic Healthcare Provision Fund. Then another thing which is key is that the National Health Act expects 1% of the Consolidated Revenue Fund, meaning the whole money that comes into Nigeria as a whole, right? Because you have the federal government, state government, and local government. But what is currently happening now is that the amount going into that fund is 1% of the consolidated revenue fund of the federal government instead of the Federation of Nigeria, right? So we see a situation where the states and the local government, permit me to say, are not putting in their own 1%
Yes.
into that fund. So instead of the deduction to happen before sharing is done, the deduction is now happening after sharing is done, and then it is only the federal government's share that is being
So
exactly.
it may not be able to cater for.
Exactly. So we look forward to a situation where advocacy should shift to that point where 1% of the consolidated revenue fund of federal, state, and local government should go into the fund, which is actually what is in the law anyway.
Yeah. Now you said this thing, and it means there's a lot that government has to do.
Yeah.
A lot of things that government has to take in place. You've mentioned accountability. You've mentioned states and local governments having to put in their own 1%, even though it shouldn't be that way. But apart from this, what more does government need to do to make sure that women have access to healthcare and have a right to health as well?
I will look at what government can do now from the perspective of Ministry of Finance. Let me look at that, as a channel to say what I have to say. You can have budget for Ministry of Health, just like you have for all other ministries.
Yes.
And some of the projects may be directed specifically at women, and some are not. Right? Now, we know that if at the 2023 budget, about half of it or thereabouts will be funded through borrowing. What happens if the government is unable to eventually borrow money from some of the places it had planned to borrow from? Right? We have a target of crude oil exploration, right? That should go on in the Niger Delta, right? Of course, not exploration now, million barrels of production per day. Now, what happens if maybe because of militancy or whatever, we are not able to produce as much crude oil as we had planned to? Or maybe for one reason or the other, we are not able to get enough, the taxes as we hope we will get. What will happen is that we are not going to have enough money to take care of all the projects in the budget, which is usually the case anyway.
Yes.
Now, if that happens, the government then prioritizes which project will I fund and which project will I, avoid to fund or maybe carry over till next time. And a lot depends on Ministry of Finance now, because they are the ones that channel available resources. It is Ministry of Finance that says, okay, we are supposed to have a budget of so and so amount, but we cannot fund everything, so this is how much we have. They are the ones that release money. Let me put it that Ministry of Finance is in charge of release. So maybe what can be done is for Ministry of Finance to prioritize projects that are of interest to the health of women. If the ministry sees women's health as a priority, it means that from the available resources, they will be able to say, okay, so and so percent can go to these projects that are of interest to women. But if the ministry does not take women's health as a priority, it would always say, okay, there's no money for this, there's no money for that, and then it keeps on delaying those projects that are of interest to women. So I think that one thing the government can do is to let the Ministry of Finance see women's health as a funding priority.
You're taking a different point of view, and it's very interesting because normally we'll take it from the point of view of what does the Ministry of Health have to do. And I believe there's something the Ministry of Health has done. But it's good that you take it from where the source of where the funds is coming from. So if we're able to tackle it from here, most likely upward, it would be done properly. But I'd also like you to take it for us from the perspective of the Federal Ministry of Health. What can they do, or what should they do to make sure that projects that are related to women are prioritized, and how can they go about this?
Well, what the Ministry of Health can do is to provide its projects, the budget for the year. But the available resources, right, will determine if everything can be funded or not. So maybe based on the available resources, the Ministry of Health too can also prioritize projects that are of interest to women. So if the Ministry of Finance gives them, let's say for the Ministry of Health budget for this year, inclusive of the Basic Healthcare Provision Fund, is a little over $1 trillion. So if Ministry of Health gives them money, which will most likely not be up to the amount that they budgeted. So the Ministry of Health can prioritize projects that are of interest to women. So if they receive less than the 1.0 trillion, which is their budget, they can then prioritize those ones that are of interest to women.
Okay, it's good that we've spoken about what government can do, but it's also essential. I think even in our previous conversations, we've spoken about what the private sector can do, because when we talk about health, it's about everybody. It affects one person or the other. In fact, so many doctors will tell you that they also want the healthcare system to be good, because even them as doctors, they're not immune to falling ill. They're not immune to having issues with their health. So what can the health sector, private sector, what can the private sector do to also aid and also help? Because that may not necessarily be their primary responsibility, but as corporate social responsibility, and for the health of humanity as well, what can the private sector do to also help that, to also see that women's health is prioritized?
Now, if you look at the private sector, most of them all have this corporate social responsibility wing. The banks, even the big firms like Dangote Group and all of that, they all have a wing for corporate social responsibility. Now, they give out grants to non-governmental organizations. One thing the private sector can do through their corporate social responsibility wing is to prioritize activities that are of interest to women's health. So if, let's say, Dangote Foundation probably has maybe 500 billion, for instance, for corporate social responsibility, or maybe that's on the high side, maybe 100 billion for corporate social responsibility, they could say 60% of this will go specifically for issues of women's health. Even the banks, they could define the priorities for their corporate social responsibility such that women's health is a priority for them. What that means is that non-governmental organizations or even business-minded organizations that want to benefit from those grants will then prioritize women's health in their own programming. So by the time the donor is prioritizing women's health, that's a private sector donor, and then the organizations that are going to be beneficiaries of those funds is now programming in line with women's health, we will automatically see a situation where projects that are of interest to women, both from the private and public and non-governmental sector, everybody will now be paying more attention to women's health. And if it happens that way, over time, you will notice that there will be an improvement in the health indicators of women. If everybody or almost everybody is doing something to address issue of maternal mortality, before you know it will reduce. The reason why maternal mortality is probably increasing or has not reduced to the extent that we want is because we are not doing enough. That is just the simple truth. Both from government, private sector, everybody, we are not doing enough. But if we have people prioritizing these things, everybody doing his or her own small bit to see that women's health is prioritized, I think that more private sector funding will go a long way to address issues of women's health.
Now let's talk about indicators, because you spoke about indicators. What could be some indicators that we would see that will make us feel, okay, maybe maternal health is getting better in Nigeria?
Yeah. Okay, so the first thing is the maternal mortality ratio, right? The number of women that have to die in the process of childbirth is a very scary statistics. Some people have come up to say at some point, maybe a year ago or a couple of years ago, that Nigeria is the worst place to be a pregnant woman. I mean, Nigeria is the worst place to give birth
to a child.
Because of the population that we have to lose during childbirth. So by the time National Demographic and Health Survey is done, or multiple indicator cluster survey is done, and we see that the maternal mortality ratio is dropping, going to a lower level, then we can be rest assured that, yes, we are seeing progress in that particular field. Even things around child health, because women's health and child health sometimes they're almost tied together. So by the time we start seeing improvements in infant mortality and all of that, issues that are around children, especially at that very young age of maybe a few weeks to months or maybe up to a year of birth, by the time we notice improvements in issues around infants, most likely there will be a rub-off effect on the indicators that concern women.
Okay. You were talking about women, we're talking about the International Day for Women, and even though we're taking a health angle to it, I'd also still like us to discuss, the world theme for the International Women's Day, that's technology. But it's good that we talk about health and technology, because we're actually even seeing technological innovations that are coming out that are trying to make the health sector a lot better. But that will be when we come back from this short break. So do stay with us when we come back from this short break. We have so much more to discuss. Stay with us.
Hi everyone, here are some practical tips on what you should do to avoid breast cancer.
Examine your breast on your birthday of each month. For instance, if you're born on the 12th of May, examine your breast every 12th of each month. Get familiar with the shape, the sizes and the textures of your breast and nipple. Don't forget to check your armpit for lumps.
Reduce the intake of fried foods. The oils used to fry many fried foods release chemicals that can be harmful to your body.
Eat lots of vegetables. This contains the nutrients that your body needs to help fight off diseases.
Tooth and gum diseases have been linked to cancer, memory loss, heart diseases, dementia, and stroke. Make sure you brush at least twice a day, especially before you go to bed. If you can, floss regularly and have your teeth checked at least once every year.
Reduce your exposure to toxins by minimizing your use of hairsprays and deodorants containing aluminum and lead as much as possible.
Avoid smoking.
Exercise regularly, at least 3 times a week.
If you have babies, make sure you breastfeed exclusively for at least 6 months.
As women, you should avoid placing your smartphone in your breast pocket or inside your bra. Some believe that this will emit high levels of radiation which could lead to breast cancer and other forms of cancer. Secondly, you should avoid or limit your intake of highly processed foods, aka junk foods, as they contain toxins that are harmful to the body.
Welcome back, and thank you for staying with us. If you're just joining us, this is Health and Wellbeing on ASO Television, and I've been here with Mr. Martins, and we've been discussing and celebrating women in light of the International Women's Day, but seeing how we can prioritize women's health generally. So I'd like us to talk about, we've spoken about what government can do or what government should do, what the private sector should and can do, but let's talk about society generally, because when we talk about these things, most especially us people, we find a way of just removing ourselves from the equation and we just say, government did not do this, government did not do that, this person has money, why didn't he do this? But for us as individuals, what can we do? How can we help? How can we aid? What can we contribute to making sure that women's health is prioritized and women also have a right to health?
Actually, if you look at the issue of health, and in this case, women's health, it's everybody's business. People make that mistake of thinking, oh, anything health is for Ministry of Health. Let Ministry of Health handle it. You understand? Or maybe anything health is for doctors. I'm not a doctor. Let them handle their problem. But the whole of society has a role to play if we are actually going to see that health, and in this case, women's health, gets the best possible attention that it deserves. For instance, if you are in the educational sector, there's a whole lot you can do to prioritize women's health in the educational sector, including even the curriculum. That is where everything starts. The curriculum. What are you teaching students about women's health? Is there a way to improve women's health through the content of the educational curriculum? My answer is a yes. obviously. So those in education have a role to play to improve women's health. Now, even those in the media, right, information technology, they have a whole lot to do to improve women's health. Yes, we are here talking about issues of health, right to health for women. So that is a very wonderful thing. So other media outlets and channels too can do their best to see that issues of women's health is prioritized. Even if it comes free of charge, even if there's, permit me to say, no direct financial benefits for doing that particular intervention, go ahead and do it. We can't live without women, so whatever we can do to improve their health, I encourage it. Apart from that, even across all sectors, even the radio stations can keep, putting out one or two jingles here and there to advance issues of women's health. Everybody has a role to play, so let's not make that mistake of thinking that, it's for Ministry of Health alone. Let them handle it. Everybody has a role to play.
Oh, okay. So let's talk about individuals.
Yeah.
Now no longer corporate organization. As individuals,
Yeah.
on our own, what can we do?
Now, we all have homes that we come from.
Yeah.
Nobody fell down from the sky. I've never heard, maybe apart from Oduduwa, I'm not aware that
And that's a
anybody.
myth, isn't that? Okay, I
Yeah.
shouldn't say that.
Obviously, no, you are right. You are right. So I think that in that small community where we find ourselves, maybe in our homes, right, we should take the argument back to the home. What can you do to improve women's health or a woman's health now if you have just one around you? Within that, your own small, immediate sphere of influence. So it could be for a man, for instance, it could be something as encouraging your wife and supporting her to go for antenatal services when she's pregnant. There are instances where some women are reluctant to go for antenatal. Maybe they've given birth once or twice or 3 times before, and then they see themselves as a old war horse in this game of delivery, and they can handle it without. So maybe that's extra push to convince her to put herself up for antenatal services. It's something. There are parts of the country where you go to and a reasonable number of women do not subject themselves to antenatal services while they are pregnant. Not just, and then there's a minimum number of times that a woman should, subject herself to antenatal services for the process to be satisfactory. For instance, you went for antenatal only once throughout the 9 months of your delivery. We can't clap for you. Yeah, we can't clap for you. So I think that even that small encouragement, small push we can give to our wives at home can also go a long way.
So let's talk about legal issues. Let's talk about legal rights. What are the legal rights of, I don't know if to put it as women now or even as citizens. Women are actually citizens anyway.
Yeah.
So if there are legal rights that citizens have, women are included.
Yeah.
So what are these legal rights that women and citizens generally have to rights of health?
Now, let me look at it from this very popular perspective. We've seen situations where somebody who is ill goes to the hospital, right? So maybe the person is seriously sick or maybe an accident or whatever. And then the medical personnel will say, I wouldn't treat you till you bring so and so deposit. And then maybe the family members or friends and associates will be begging, doctor, please start treatment now. Please treat our brother or our sister. And then the medical personnel can say, if I don't see so and so amount of money, I will not commence treatment. Sometimes the patient may even die due to late commencement of medical attention. The provision of the law is that no medical personnel should deny anybody emergency treatment on any grounds, including financial reasons. So it is your right to receive medical care, especially when it is an emergency treatment, even if you don't have the money. What the law expects is that the patient in question will receive the care when he or she has been brought to a point where he or she is now stable. The issues about money can then, be put up. How do we take care of the bills and all of that? But it is wrong to deny any individual, in this case patient, emergency medical attention because of maybe not the absence of money.
Most times it even boils down to finances.
Yeah.
Most times, even with a cash crunch,
Yeah.
we've heard stories of people saying they lost patients and they lost loved ones because they didn't have cash available, and then the things is transfer and all of that, it didn't work. But we haven't seen doctors being prosecuted for that.
So that is the thing. You have the patient has the right to receive treatment. Even if I know there are some hospitals, I don't want to start mentioning names.
Of course,
here,
we wouldn't do that.
That we say they take only cash. I know some hospitals during this cash crunch will be facing.
Yes.
If your patient goes there, they will say no, you have to bring cash, and then they will refuse treatment. Just like you said, people have even had to lose their loved ones because they couldn't get the cash.
Yes.
For no fault of theirs anyway. So somebody's head should roll for that, loss of life because of inability to bring money or cash at that particular point. Somebody has to be punished because that patient who died has a right to emergency medical treatment, whether he or she has the cash or not. It should be treated. I've also seen situations where maybe an accident victim, for instance, and they will say we need police reports before we can take care of you, and maybe in the process of getting the police report, the person eventually dies or something. No, that person has a right to emergency treatment, whether police report has arrived or not. When he or she is resuscitated to safety, then the issue of police reports can then become an issue. So just like you said, you've not seen doctors prosecuted or anybody prosecuted for this kind of negligence or insisting on money before giving medical attention. That is because most people don't even know that they have this right. Right? People don't know. It is only when you know your right that you can lay claim for your right. If you don't know that this is your right, somebody will come and take it away from you and maybe give you 1% of it. And then you'll be clapping for the person. Thank you very much. But it's basically yours. So it's because people don't even know that they have this right. That is why the medical provider can do it and get away with it. But if people become aware and insist, and in these cases where persons have died, take legal action, and 1 or 2 or 3 personnel in the health sector is punished, others will learn from it and then avoid this kind of a practice. So maybe advocacy should push towards enlightenment for people to know that this is the right that they have. And then, of course, every right also comes with obligations that are expected of it. If you are receiving rights for something, you also have a role to play, right? Yeah, you have your responsibilities to see that the system is working properly. It's a give and take situation. So I think that while you have a right to receive medical attention, you also have a responsibility to, permit me to say, report yourself or subject yourself to medical evaluation if you have any illness that is of public health concern. So if at any point you have a medical condition that has been designated as a condition of concern, even if you are in your room, you should go and report yourself to the authorities that this is what I am feeling, and then they will not know the best line of action to take. You don't have a right to say, I'm the one who is sick, it's not your business. If I'm sick, it no concern you. No, it's everybody's, your health is everybody's concern. At any point where your health becomes a problem for the health of the society, then you need to take action.
That's something that we need to take very serious, because in this part of the world, you know that if someone is not almost falling, they don't feel the need to go to the hospital.
That's very true.
And I would say it, and I've been guilty. There was a time last year I just don't know what was happening to me, and they kept saying, go to the hospital. I'm like, okay, I'll go to work. After work, I'll go back home. Till I started feeling my heart palpitating unusually. And I had to, my boss had to say, leave this work and go to the hospital, And because there's just a way we know how to form so much macho, even if you are ill, like you feel like, okay, I'm still feeling a lot better, I could do more, I could do more. So these are kind of conversations we should actually have more and more, because the slightest, when your body even shows you a small sign, it actually means that you are not well. Even if it's a slight headache, it means that something is wrong with the body, because normally you're not even supposed to have that headache. If it's just a little pain, your body is not actually supposed to pain you. So it actually means that something is not well with you. Even if the other parts of the body are okay, that pain is actually a sign that something is wrong with one part of the body, and different parts of the body are what make up the body. So if we allow this one to linger over and over again, it will just be a short while before, the entire body responds to this. And when the entire body is responding, it's almost like it's at once.
Yeah.
That's because you have endured pain, or you have endured this thing for so long, it has affected every other part of the body. So just like you said, yes, it's a good conversation for us to have, that, it's your responsibility. And because it also even helps to cut costs. If so many times doctors say early diagnosis is key to treatment of most illnesses, even the, in quote, most dreaded cancer. They say if you are diagnosed early enough, treatment wouldn't be as bad, and then you could even recover faster from it. So it's also a responsibility to us, because it helps to even strengthen the healthcare sector more. You don't have to spend more on treatment if you are actually diagnosed early. But let us talk about challenges. What are the challenges faced in making sure that healthcare services are available to everyone? Now, not just women now, anyways, but to everyone.
I think that politics is a major consideration.
We're in the season.
Yes, politics is a major consideration. We've seen situations where people who are in authority, permit me to say legislators, it happens across all sectors, but let me just say this with legislators, maybe through their constituency projects, right, will choose to cite the primary health centers in their own village, for instance, or in a village that they want to patronize for political considerations, even if that particular village is not the most central location for that particular primary health center to be. Now imagine a situation where a particular town or ward has maybe eight villages, for instance. And somehow, by the time you look at those 8 villages, there's usually an area that is most central for health service. So, but if I want to be smart politically, I could end up putting the primary health center in my own village, which may be in one extreme of the town. And then automatically it makes people in the opposite extreme to have challenge in accessing healthcare services. And apart from political consideration, sometimes corruption too is an issue. Because in Nigeria, everything is an opportunity for someone to make money. That's unfortunately how bad the situation has become. So people are always looking at what can I gain from this particular project. So by the time a project is brought forth, we should have benefited almost everybody, right? By the time people start picking things, just cutting corners to make sure that they gain from the project. For every money for healthcare that is stolen, there's somebody somewhere that has been denied healthcare service. Even if it is 1 million naira that you took, and you say, it's very small now, 1 million out of the total 21 trillion naira budget of Nigeria, somebody will pay with his or her life for that. Even if it is 1,000 naira, somebody will pay somewhere, because that money was meant to provide a particular service. So I think that corruption is an issue. And then another thing too is insufficient resources. Government would always say we don't have enough money to provide, healthcare services for everybody. So, and so long as the money is not enough, it now looks as if a good excuse has been gotten. Even though I would now look forward to a situation where innovative strategies are brought forth to generate the resources. But looking at our current situation where we are not bringing in as much resources as we would want to, I think insufficient fund is also a challenge for government.
Okay, so you've brought us to the point. innovation.
Yeah.
The theme for this year's International Women's Day is Digit All.
Yeah.
So everything has to be digitalized, yeah? Innovation and technology for gender equality. How can technology be used to make sure that, health services are available? In what ways can this be used? What innovations can be used? Technological innovations can be used to ensure that people have access to healthcare services, and not just access, but access at the time that they need it. That's very important. How can we do that?
Anything you are doing, not just in health now, anything you are doing and you're not bringing in technology into it, you are joking. That is the simple truth. Even if it is in education or any other sector, whatever you are doing, you should be asking yourself, how can technology play a role to improve this particular thing that I am doing? Now, if you come to the health sector, we are beginning to see more of telemedicine. Telemedicine was not a very common thing years ago or many years ago, but it's becoming more and more common. You could just through your phone download the mobile app, right, that gives you access to see a doctor real time. So if I need medical attention now, or as a woman needs medical attention now, but she's in a location where for one reason or the other, she cannot access a medical doctor. Through her phone and through the mobile app in her phone, she can see a medical doctor, explain her situation to the personnel, and then the medical personnel will also give her the necessary advice or medical attention online, right, via the mobile app. So this is an innovation that can save lives of women, because most times, we've seen situations where a woman can find herself in a position where she needs medical attention, but there's no doctor, around there. So at such a time, technology and innovation can come in. And apart from that, there are many other innovative ways that, can be used to improve healthcare delivery, especially as it concerns women.
Okay, so let's talk about reforms, for us to even be able to incorporate this. You're talking about telemedicine, and this is more of the private sector. It's mostly people just coming up with innovations. But what kind of reforms, and when I say reforms, I'm talking about technological innovations, technological reforms, can government adopt that would also make sure that these things are made available? Because it's a lot easier if you go to hospitals, just a random survey at hospitals, you realize that there are more people at government hospitals than at private hospitals. And that's because government hospitals are more affordable. So, and that's where majority of the populace seek for healthcare. How can government adopt these technological innovations to make sure that as many people as possible benefit from this?
In fact, there's even no too much stress. It's not like what government can do is not like, discovering the moon or inventing something entirely new.
Yes.
Right? So you are right when you say the telemedicine and medical innovations are usually more in the private sector. You are 100% right in that regard. So I think that innovation is out there for everybody. Once the technology has been put up, it's out there for interested parties to benefit from it. So what government has to do in this case would be to show more interest in technological innovations. So the telemedicine, for instance, which we've talked of, nothing stops the government from playing a lead role in the whole telemedicine technology, so that even publicly owned healthcare facilities can begin to use more of telemedicine to attend to their patients when the need arises.
That's great, and that would really go a long way, starting from, even though you may start from urban areas, but we know that it would eventually trickle down to rural areas. And it would even amaze us to know that when we talk about phones and people say that people in rural areas don't, that's not necessarily true.
Yeah.
You go to thick areas, thick villages, and you see people with smartphones. It could actually work, and that's a good one. Well, thank you very much, Mr. Martins, for taking our time to be here with us on the program. We sincerely appreciate your presence, and thank you for celebrating with us, women.
Thank you very much. Nice being on the show.
Thank you very much. Well, that's the size of the program today. Women represent the cornerstone of a family's overall health. Ensuring they have access to quality care also can lead to improved health for children and families. Well, that's the size of the package. You can actually follow me on social media at Lois Abba, LOYCEABBA, for your feedbacks. Keep it a date with us same time next week. I am Lois Abba Sambo. Do stay safe.